Bismillahirrahmanirrahim. Imagine you're sitting in a waiting room. A woman suddenly starts crying. 5 minutes later, she's laughing. 10 minutes later, she's flirting with everyone around her. Across the room sits another patient. She isn't trying to get attention. She already believes she's the most important person there. One wants the spotlight, and one wants a throne. One says, "Look at me." The other one says, "Admire me." And that single difference, my friends, is worth 3 points on USMLE. Let me prove it. Let's meet these two people properly. Histrionic personality. Think of her as the actress of the waiting room. She walks in and immediately the whole room must notice her. She'll cry, she'll laugh, she'll flirt, not because she's evil, but because she without your attention, she feels completely empty inside. She is warm, she's shallow, but she's present. Okay? She's desperate. Now meet the narcissist. Meet the narcissist. She doesn't need your attention, she needs your admiration. She will be cold, she'll be entitled. She already knows she's better than you. She expects special treatment, not because she's insecure, but because in her mind, she genuinely deserves it. She is cold, she's entitled, she feels nothing for you. Same waiting room, completely different psychology. Histrionic wants the spotlight, narcissist wants the throne. One thing, if you remember, for both of them: histrionic, one-liner, "Look at me." Histrionic will say, "Just look at me." The only thing that concerns histrionic is just looking at her. And narcissist wants admiration. She or he doesn't want you to. She doesn't want you to look at you. She wants you to admire her. Admire her. If the center of attention is put away from the histrionic, she'll cry, she'll laugh. But narcissist, cold, very cold. Now let's walk you through an MCQ and see you can actually differentiate the narcissist from histrionic or no. The first MCQ we have here is: a 50-year-old woman arrives late to her appointment and lies about the reason. Okay. She demands to be seen immediately. Okay. Saying her time is more valuable than others. Okay. Now I'm seeing some things here. She brags about her successful career, calls herself a wonderful mother, but cannot understand why her children never visit her. What is the best explanation for her behavior? And the correct answer here is: she is a narcissist. Now let me explain this. Let me break this down, because this question is screaming at you that I'm narcissist and I'm not histrionic. First of all, she lies about the reason. Okay, that tells us nothing. Histrionic and narcissist can lie. Okay, let me see the other clue. Her time is more valuable than others. Okay, that is the first clue. She thinks her time is important than anybody else. She don't care about you. She brags about her successful career. Okay, so she is boastful as well. And she calls herself a wonderful mother. Okay, that's a third one. But cannot understand why her children never visit her. So she's unable to understand any reasons of why children never visit her, because she's only concerned about herself and center of her. Okay, so that's clues. All of the clues point us to just a single diagnosis, and that is narcissist personality disorder. Let us do another question and see if you actually know the difference between both of them or no. Now I want you to look at this vignette very carefully. A 28 years old woman, routine checkup, nothing serious. But the moment she walks in, a bright red dress. Look at this. Wearing a bright red dress and heavy makeup. She wants every single eye on her. She keeps touching the doctor's arm. She speaks dramatically. She's performing like she's on a stage, and the doctor is her audience. Look at this. When the physician, the most special bond I've ever had with anyone. Now that is one thing. That is one thing that I missed previously. That is her doctor, a professional relationship, and she has turned it into the most meaningful connection of her life. Why? Because histrionic patients don't want attention from anyone. They need it from everyone all the time without exceptions. And then the doctor stays professional, doesn't reciprocate, keeps appropriate boundaries, and then what does she do? She falls apart. You don't care about me at all. That one sentence, you don't care about me at all. That one sentence, that is your diagnosis. Because a narcissist would never say this. A narcissist doesn't need your care. A narcissist needs your respect. But this woman, she needs you to feel something for her. She needs the warmth. She needs the connection. She needs you to look at her. That is histrionic, my friends. Now let me give you the final rule, and I want you to write this down. When the patient is warm, dramatic, and desperate for your attention, that is histrionic. Look at me versus admire me. That's it. That's the whole exam. You will never get this wrong again. And if the video helped you about different personality disorders, subscribe to my channel, because every single day I break down these kind of questions, the ones that trick 80-90% of the students, in the simplest way possible. And if you want one free high yield MCQ every single day, just like the ones we did today, join my free WhatsApp channel. The link is right there in the description below. It costs you nothing, and it might just save you on the exam day. I'll see you tomorrow. Let's get this match together.